be meeting up with Dr. Sonia virtually, of course, regularly because, as a consumer, I want to know what can I do, what can all of you do to take care of our skin, preventative and otherwise, and without going in to see Dr. Sonia and her incredible staff. And Dr. Sonia, one thing I love about you is you are big on education. So why don't you just tell us what can we do and how can we stay feeling good about ourselves?
Well, I think that simplicity always is best, right? So right now we're in our homes. We're quarantined. A lot of people have been breaking out through stress breakouts and all sorts of things. They're wearing
Right.
their masks, they're getting dry, they're getting irritated. And I like to make things as simple as possible. So if you're not already doing the basics, and what's the basics?
Right.
Really, the most important thing for me is when I talk about skin, because I'm so passionate about it, that I want for everyone to see results. So
Yes.
everything that I do and say is all about getting the results that you're after. And results driven skincare really is about being on a physician grade, medical grade formula that is highly concentrated, power packed with the great ingredients that are science backed to really get into the skin, penetrate deeply into the skin to get the results that you're after. So choose
Okay.
a good physician grade skincare line.
Okay, so I'm so glad you brought that up because here's the thing. Right now, I can't, I've, of course, I love your products, but for those of you who don't know about your products, I mean, we're just going online, we might but somebody, what's the difference between the girl in the white coat, say, for example, at the department store, and they've got a lot of products and they look really great. And honestly, all due respect, a lot of them are really expensive. How do I know that versus okay, boil down the ocean. What does physician grade formula really mean and what are the benefits for me?
So that's where, you go to the drugstore, you go to the department store, and there's a sea of products and a sea of people coming at you with, the greatest, best potions
Right.
out there. So it's really important. It's very confusing. So
Right.
it's really important to understand what the difference is. So you have over the counter products down here, which are not FDA regulated. And then
Oh,
you've got
I never thought about
prescription
that.
grade. Yes, prescription grade products we know are FDA. They have to go through the rigors of safety and testing. So
Oh, I
where
didn't know that.
yes, there's nothing in here. I could add a drop of an ingredient, which I recommend is retinol, and say, here you go. I'm a retinol product. Use me, but you're not going to get the benefits of a retinol product, which is lines, wrinkle prevention, brown spot, clearance, texture, all of the good things that we're after. However, when you go to a physician grade line, which is right underneath a prescription grade line when it comes to potency, highly concentrated
Oh,
formulas, and really doing the job to penetrate into the skin, because that's what we're after, is we've got to make sure that it can get into the skin barrier to do its job in highly concentrated forms. Well, physician grade formulas are much more likely to do that than an over the counter formula will.
okay. And is that why you can't buy those at a department store, for example?
Correct. Yes. And in fact, if you go to a department store brand, which are much more highly expensive, they've got all sorts of claims, lots of marketing behind it. If
Right.
anything, they will actually irritate your skin more because they've got a lot of fragrances and perfumes and fillers. And I see it all the time. I tell my patients, bring your bag of skincare products to me. Let me evaluate everything. I look at all the ingredients. I inspect all of their skincare. And most of these products are just that. They've got a lot of fillers and fragrances that skin will react to, and then they wonder, why am I breaking out, why isn't this working, or my
Oh, wow.
and also your skin changes as
Right.
we get older. Our skin actually gets more dry and it's more apt to getting irritated.
Hmm.
And I've had people who have told me, I've been using this product since I was 20 years old. What happened? Well, something changed. You're right, your skin changed. Your skin
Right.
is not liking that same product that maybe it did or was more resistant to back when you're 20 years old. So it's very important to continue to modify your beauty regimen at every decade of your life.
Okay, well, I'm learning from something really important that you said here, the physician grade. So many people nowadays are into cleaner eating, cleaner living, right? It sounds to me with the physician grade formulas, it's almost like cleaner makeup. Is that a fair thing to, or cleaner skincare? Is that a fair thing to say, Dr. Sonia?
Well, there's definitely also another marketing hype over the counter is they do talk about more holistic based skincare. It's more natural. However, there are problems with more natural based skincare. So even though it's got, these plants and all these derivatives and oils, I've seen people even react to those kinds of natural holistic formulas. So when we talk about physician grade, what we are talking about is really results driven, science backed. We know that it works, but you do have to use it appropriately, right? So we're not just going to be using everything every day. We're going to actually go very slowly to
Oh,
make sure we can integrate it along with your skin type, along with
okay.
your, follow-ups with the physicians or the providers, so we can actually help you through it. Because at the end of the day, there's two most important products that we know are science-backed that prevent aging as well as skin cancers, and that is sunscreen and retinol.
Hmm.
Unfortunately, retinol can be very, very highly irritating, and probably only a portion of people are actually on the right retinol for their skin. All
Interesting.
dermatologists agree retinol is something that we should all be on. That's our secret for anti aging, but very few people are. And the reason
Okay.
why is because they're not on the right one, or they're not getting the appropriate supervision to get them on the right one.
Okay. Well, you have fabulous products and you have a great website, but now that I can't come in and see you and get a consult, how do I know what a good quote unquote recipe would be for me to start on your skincare line? How do I know that?
So I recommend going, again, very simple. And I talk about 3 P's to pretty skin. So what are the 3 P's to pretty skin? Number one P is you want to prime your skin. Prime your skin with a good exfoliating cleanser. And there's a wide variety to choose from. But again, physician grade exfoliating cleansers are going to help with removing some of those dead skin layers that don't belong on your skin so products can actually penetrate better. So
Okay.
first, prime your skin. Number two is you want to actually peel the skin. Peel the skin with a gentle retinol formula. And so by doing that, you're helping with lines and wrinkles and brown spots and texture and even acne breakouts,
Wow.
pore size. I mean, this is your fountain of youth. You want to get on a good retinol, but you want to be very careful and go very slowly. The final P, 3, we talked about was protect, prevent with a good medical grade sunblock, which is highly concentrated on the good stuff, zinc oxide based, sheer, transparent, but also does the job from blocking and shielding from the sun's damaging UV rays. So those are the 3 P's that I say to start with very easily.
Okay, so that was my other question. What's the difference between over-the-counter sunscreen and a physician-grade sunscreen, for example?
That's a great question. Over the counter, 95% of them are going to be chemical sunscreens
That doesn't sound
versus
good to me, Dr. Sonia.
right. So chemical sunscreens, people don't like them, right? Why? Because there's a lot of controversies around them. Well, does it get into your bloodstream? The way that they work is they get onto your skin.
Exactly. Yes.
Yes, and they enter into your skin and they act like a sponge so that UV can still enter and it absorbs that ultraviolet radiation. And then now there's controversies, does it go into your bloodstream? And then we know
Right.
it's not good for the environment either. It's killing off our coral reefs out there in Hawaii. So now physical blockers are really the safest sunblocks to be on. They contain zinc oxide, and higher concentrated zinc oxide is going to literally, kind of like little speckles of zinc oxide that literally just bounce off radiation, is going to shield you much better, and it's safer and it's more organic, more
That sounds
holistic.
perfect. It's not getting into your skin as much.
Yes. And it
I
won't
love that.
irritate your skin, especially if you have breakouts or you're allergic to sunscreens, or you don't know which one you should be on.
Right.
Zinc-based sunblocks will always work better and be better for your skin. And then my skin of color patients, they come in because they think they don't need sunblock. And in fact, they do, because we also get skin cancers or we get brown spots, and that prevents those, damaging UV rays from causing those problems.
Okay, well, this is fabulous. And God, I've learned so much I didn't even know about before. But okay, so how, let's just say I'm just starting out on, I want to do this. I want to do the best for my body and take care of my skin, especially now. Because I know a lot of your patients come into you regularly and you get that. It's kind of like getting a lube oil and filter for your car, right? You know what to do, you get a little checkup, you get your
Yes.
supplies, but not everyone can come in right now. So for someone who's listening who wants to start day one today, Dr. Sonia, what would be the best thing? How do they go about this? And what kind of results can they expect?
So Jules, great question. I think that the 3 P's are a great place to start. If they need any help, certainly we have skincare concierge that can actually walk you through, understand your skin type, recommend an actual regimen for you, sort of a quarantine regimen.
You mean on the
Easy
phone?
routine.
You
On
mean
the
on the
phone, you
phone?
can give us a call and we'll have our skincare concierge team actually
Oh,
individualize a program just for you. or you can go directly onto our website and we have all of the things that I'm talking about. You'll just want to start in a low concentration. So
Okay.
exfoliating cleanser, for example, we have a brightening scrub, which is my favorite. That's what I use. It's a physical exfoliating agent with a little bit of glycolic acid, salicylic acid. Again, removing the dead skin layers. You want to start slow, couple nights a week, see how that goes, and then you can build up to it. When you're sensitive, you want to be careful and maybe reduce the time frequency. The second P, the retinol, the most important step and the most problems that I see is that people don't use it properly. It's only a pea-sized amount on the full face. The problem is people don't use the right moisturizer on top, so therefore they
Okay.
can get dry, they can get irritated, or they use it too quickly, too soon. So again, only a couple of nights a week. A little bit goes a long way, and it'll last you actually longer. So pea-sized amount, maybe 2 nights a week. Then the next week, if you're not dry or red or irritated, you can increase it to 3 nights a week and just keep going up until your skin can tolerate it every day. And your skin will be able to tolerate it every day over time. Just have to go slow. And
Okay.
then the
So
final 3 was your protection. You want to protect also indoors, outdoors, rain,
right. So we talked earlier, and you mentioned something about an acclimation phase and what we can expect. Explain what that is to people.
So your skin does go through a period of, desensitization. It's gotta, it sees something that's new into, the body, and it's reacting to it, and it just takes time for it to understand that this is actually okay to, penetrate into the skin. It's doing its job with remodeling collagen. It's creating collagen. Retinol or vitamin A is something, we can't eat enough of to get into our skin, which is why a high potent vitamin A cream is the best thing to apply onto our skin to get the best potent penetration. And that retinol that then gets converted to tretinoic acid, which is actually the prescription grade level, which is what we want. That's the good stuff. That's basically what's doing the collagen creation, and therefore becomes preventative for you over time. So once I knew the science behind vitamin A creams, that's the first thing I got on in my 20s, and I've been on it since then. And
When you
actually,
have fabulous skin.
I just
Right.
found a picture. I found a picture of myself.
Look at
I,
you.
I
How
was
old were you there,
20.
Dr. Sonia?
I was 20 years old,
Jesus.
and
You don't even look like your skin's fabulous. Okay, so
I'm at
listen.
Jules. You don't know this about me, but I'm actually 85 years old.
Yeah, exactly. I think we're the same age. That's amazing. So is the product expensive, Dr. Sonia? I mean, that's the next question, right?
So great question, right? When you go to the department stores, I can't tell you how many patients spend so much money there. And in fact, our whole skincare system, the 3 Ps I talked about, is actually less expensive than one bottle of the department store brands that is, touted to be the miracle cream, that, miracle cream in a bottle. So if anything, it's actually more cost effective, and you need less of it, and it'll last longer over time, and it's more potent. So it's actually doing the job that it's supposed to, that's designed to do. The over the counter stuff is maybe at the most a good moisturizer, but you're not getting the good stuff.
Okay. So I have a great one question I really want to ask you before that. What are the top 3 reasons people go for the skincare? Really?
So I think that the most important things right now are people are looking for prevention. How do I prevent things on my skin so they start actually younger, and then they need less Botox and fillers over time?
Okay.
To my more mature skin who already has sun damage or they've got anti-aging concerns, they're the ones that are coming in with the whole system. And then I've got my skin of color patients who need more brightening or have brown spots and acne. They're the ones that are coming in for the brightening kits. And then, of course, I've got my medical patients who also have acne and acne scarring, and trying to just help with, maintaining and preventing future breakouts.
Right. Okay. So for me personally, for some reason, ever since I've been 15, I always doused in sunscreen. I wore the hat. My friends used to call me Casper at the beach because I didn't want to get, but thank God now, right? Because obviously my skin's not, I mean, I think it's pretty good, but I don't have a lot of sun damage, thank God. All right. So, but I haven't truly experienced the physician. I haven't made that part of my routine. So you know what I'd like to do? I would like to get the products that you would recommend for me. Mm-hmm. And then, seeing is believing. I would like to do another one of our upcoming segments. I would like you to show me exactly what I should do, because there's a lot of people that fit my profile, right? And
Yes.
then in upcoming segments, why don't we show the products for different age groups and different categories and give an example of, because
Yes.
listen, this sounds fabulous, but I need someone to hold my hand a little bit and show me what to do.
Right.
Would you be willing to do that?
Absolutely. Yes. You got your own dermatologist right here.
Right. Listen, well, Dr. Sonia, we know how busy you are, and I know a lot of your patients are still reaching out to you. But the other thing I love about Elite MD Spa is that you have that concierge. So that's still ongoing right now with someone. Yeah.
Absolutely. So you can actually call us, and a skincare expert will be able to walk you through it, understand your skin type, your goals, and will be able to suggest products, as well as being able to follow up with you even virtually. So making sure you're, doing okay, because like you said, Jules, I'm not sure if I'm using this right, or I'm starting to develop a reaction. What do I do? Well, we
Right.
can walk you through that process to eventually get you to a great maintenance phase.
Perfect. Well, listen, I always want to offer a special to people who are watching anything I do. So what can we give them today?
Let's give them 10% off all of our full comprehensive line. I want everyone to try it and see what works for them.
Okay.
And we are offering free shipping at this point as well during the quarantine time. So
Nice.
please do. I'm happy to offer that. Thank you.
Okay. So EliteMDSpa.com is your website. And my friends, we are going to be definitely meeting up with Dr. Sonia regularly, because right now is the time we have the time to get. What about this, Dr. Sonia? Let's make it the skincare challenge. Right now is the time to get that going, right? To get the routine going.
Yes.
I mean, how long does it take to make a habit, right? How long does it take?
Yes. So I think to get your glow on and to really get committed, I mean, you're looking at getting the products and just easing into it over the next month, 30-day challenge, and get yourself really. It takes 21 days for a habit to kick in, and then it's yours as long as you keep up with it. Just like you brush your teeth every day, you want to be really regular about your skincare if you really want the best, bang for your buck and the benefits behind a medical grade skincare line.
Nice, and thank you once again, everybody. I encourage you to send in your questions or comments. Dr. Sonia can answer your questions. And once again, we're going to be meeting regularly. Dr. Sonia, thank you so much. I'm going to get your products sent to me.
Yes. And Jules, the other thing I'll recommend is, if anyone has any questions, they can feel free to DM us on our social media as well. We do respond back to DMing a lot of times, even I do. So they can check us out, Elite MD Spa, on Facebook and Instagram. They can give us a call at 1-833-Dr. Sonia, or they can visit our website at elitemdspa.com, and we'll definitely do a 30-day challenge in the future.
Nice. Well, Dr. Sonia, appreciate you so much, and we will be in touch with all of you in our next episode. And stay healthy, safe, and stay beautiful. Thank you. Bye, Dr. Sonia.
Thank you.